So what I would like to encourage members of the public to do is a few things. First and foremost, what the data shows is those that are vaccinated and those that are boosted have a very high chance of not having symptoms, or if they do, having mild symptoms from the Omicron variant. Secondly, the patients that do get exposed to the Omicron, they're the virus infects the upper respiratory tract quite a bit. So what the data is also showing is that the load, as Your Excellency would have said, the load of the virus that we get exposed to is very important. How do we decrease the amount of virus that gets into our airways? Is by ensuring that we wear a mask and encouraging others that are around us to wear a mask. So whilst we have a high load of virus that's going to be circulated with the Omicron variant, once we wear a mask, the risk of getting a high load getting into our areas is far lesser, and that will decrease our risk of having a severe form of the disease. In addition to that, there are certain things you can do to prepare your immune system. So ensure you use your vitamins, especially your vitamin C, your D, and zinc. The data shows that those things help to keep your respiratory tract and your immune system strong. So during this month of January and February, ensure you eat foods that are high in those vitamins, or take your supplements to ensure you're prepared. And for those that are not vaccinated, those are the persons that are at risk of having severe disease from the Omicron. Whilst it's lower than Delta, it's still severe enough that it can't hospitalize you. So for those members of the public that are vaccinated, I would like to encourage you to practice the prevention measures, get your vaccine, stay away from the members of the public as much as possible until you get the effects of the vaccines kicking in about 2 weeks after you would have taken it, so that you can be protected like all of us here who would have taken our vaccines. And we are very confident. I'll tell you this much. I'm at the front line seeing the patients that are coming with Omicron. Their severity is far lesser so far. And I'm very confident that if members of the public practice these prevention measures and take their vaccines, I'm very confident that as a country we will get through this in a very effective way.